Hi, I'm Megan, and I'm a physical therapy student at BU.
Hi, I'm Karen, and I'm an occupational therapy student, and let's talk about our degrees. Here's our first question. What does your major actually involve?
So, a Doctorate of Physical Therapy degree involves learning about the body systems and then learning how to evaluate, treat, and diagnose a patient in front of you. So whether that's learning how to ask the right questions to provide the best possible care for your patient, or how to prescribe exercise to the patient in front of you, how to create a plan of care to help progress your patient towards their goals. And so you hone all of those skills through your time in the program.
I think occupational therapy is much more functional focused. So our goal for a client would be to get them back to their functions, which is like the things that they need to do. So things like dressing or brushing your teeth or brushing your hair, how children engage with their school day. These are all different functions that we really examine. So part of the Doctorate of OT program is what you said, but then also adding in how we assess function in people's lives.
Here's our next question. What are your classes and professors like?
They're awesome. We do a lot of theory, and we also have some really hands-on, skills-based classes. And then we also have more client-facing classes right now, where we have clients actually come from the community. They come to BU, and we get to treat them.
Our classes are similar. They're a lot of fun. They're a lot of hard work because it's a lot of content to pack into a small amount of time before you're out and treating patients, because we go on our first clinical experience where we work with patients our first summer after our first year. We spend a lot of time with lecture content, so learning about the body systems, learning about the research behind what we're doing, making sure we're giving the best evidence-informed care. And then we have a lot of lab time as well, so working on our skills. Our professors are fantastic. They're all experts in their field. They all are practicing PTs, and they're all really dedicated to helping us learn throughout the program, and you can go to them for anything, which I think is really great.
I love my professors as well. They love to say that we're going to be their colleagues in a few years, so they don't like to think of themselves as really professors. In that way, we're starting to build that colleague relationship even from school. Here's our next question. What type of real-world experience can you get while in school?
A lot. BU has 4 clinical experiences for the PT program, but at the same time, I have a lot of friends, and I as well work as a rehab aide in PT clinics, and I think that's really valuable that so many people in the program do that because those are great opportunities for real-world experience while being in school. Okay, and our last question, in what kind of settings do you do this work?
OTs can really be found in all settings. In a hospital, an OT might help someone rehabilitate from an injury. We can also find OTs in schools and helping children develop. OTs also find themselves in community healthcare settings, so community mental health is a big sector. Helping people move through homelessness is a big sector. Children without homes or foster care systems. OTs also have a pillar of advocacy in our field, and so a lot of OTs can actually get into policy if they're advocating for a certain client group. I think that's a really cool lens and perspective that OTs can bring to that setting.
I also think for PT that they can work in a variety of settings, which is so special. So they can be in your quintessential outpatient orthopedic center. They can be in a hospital setting. They can be in a school setting. You can see PTs in a skilled nursing facility where you'll see OTs as well. There's a lot of variety and a lot of options for people coming out of school and what populations they want to work with and where they want to be.
We love our fields, and it was so great talking about this.
Thank you so much for watching, and we hope this discussion helped. Bye.